Governor Kathy Hochul has declared monkeypox a disaster emergency in New York.
The state's Association of County Health Officials says that the virus is causing new challenges for an already strained public health system. Capitol correspondent Jamie DeLine explains how.
The front lines of COVID to now helping those with monkeypox, county health departments have been especially busy.
They're taking a look at the numbers. They're helping people who have symptoms, doing contact tracing, case investigation. They're working with community providers to make sure that communities have the education they need to know how to prevent monkeypox transmission and protect themselves in the future.
Blisters, rash, and flu-like symptoms are some of the characteristics of monkeypox, a disease that can spread by skin-to-skin contact. On Friday, Governor Kathy Hochul declared a state disaster emergency after more than 1 in 4 cases of monkeypox in the country are in New York State, primarily in New York City.
By declaring this, all vaccinations of monkeypox and cases must now be told to the Department of Health. That was not the case before. Why is that important? Because when I'm making the case to the federal government that we need more doses, more than we've been previously allocated, I can demonstrate there is high demand and need.
This is something Sarah Ravenhall of the New York State Association of County Health Officials says is a good thing because the declaration also allows more people to give the vaccine.
Midwives, pharmacists are able to now vaccinate for monkeypox, just to name a few of these professions.
This is important to health departments that are facing funding and staffing issues.
We're also seeing challenges getting qualified public health workers into the field, particularly in rural communities. So we need qualified candidates working at local health departments, and we need the funding to hire these really important professionals.
The association is calling on the federal government to include monkeypox in the PrEP Act to help protect local health departments from liability and to broaden the scope of vaccinators on a federal level. Reporting in Albany, I'm Jamie DeLine.